During the following modules, we will demonstrate the 4-position technique that includes supine, pull to sit, suspension, and prone positions. In each of the demonstrations, you will see babies with typical motor development and atypical motor development at newborn to 1 month, 2 months, 4 months, and 6 months of age. We chose these ages to mirror the schedule of well-child visits that you see in your clinic. These demonstrations will provide you with clear images of typical versus atypical motor development. Before we begin, Dr. Rao will share with you how we will be identifying red flags to watch for during development.
In addition to the 4-position technique that Dr. Alfieri will guide you through, we will highlight some red flags that you can watch for during the exam. There are 2 categories of red flags that we will share with you. The first includes red flags that are independent of age, and the second category includes red flags that are specific to development at each age. The following are red flags to look out for at any age: any loss of skill or regression of motor milestones, extremely low or high tone, asymmetry in tone and strength, acute onset of weakness at any time, respiratory insufficiency, bulbar symptoms including hoarse cry and swallowing difficulties, and fasciculations. After each module, I will also share the red flags that are specific to that developmental age so that you can add them to your red flags watch list. In addition to watching for red flags, it is also important to take into account any risk factors that a child might present with when you're assessing an infant's development, such as signs of prematurity, including low birth weight, being small for the infant's gestational age, and periventricular leukomalacia, birth complications, seizures, neonatal infection, an Apgar score less than 7, brain bleed, neonatal stroke, encephalopathy, and underlying genetic, metabolic, or medical conditions associated with atypical tone.
Now let's get started with our 4-position exam. After showing and discussing motor development at each age, we will share some non-motor milestones to look for in 3 categories. 1, social and emotional development. 2, language and communication. And 3, cognitive development, including learning, thinking, and problem solving. As you conduct the exam, it's important that you consider what state the baby is in during the exam. Factor in whether the baby is awake and active versus quiet or sleeping. While part of the exam at each position is observational, you will also be examining the baby for resting and active tone during movements.